Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
My name is Dr. Mattie Rosi-Schumacher, and I'm a PGY5 resident at the University of Buffalo. I'm here today speaking with Dr. David Sherris, a facial plastic and reconstructive surgeon and chairman in the Department of Otolaryngology, Head and Neck Surgery at the University of Buffalo. Today, we are pleased to share the results of our latest study, Outcomes Following Rhinoplasty Using the Combined Septal Extension-Columellar Strut Graft. As you all know, rhinoplasty is a complex surgical procedure that is uniquely different for each individual patient case. During the surgical alteration of nasal architecture, the surgeon must pay particular attention to reestablishing a strong structural integrity while improving or maintaining the nasal airway. In cosmetic rhinoplasty, there's the additional task of improving the aesthetic appearance of the nose, oftentimes through precise and meticulous refinements. Cartilage grafting is the mainstay of surgical techniques used in rhinoplasty, and a multitude of literature exists dedicated to describing current techniques or improving on existing ones. In our study, we describe outcomes of rhinoplasty using a novel combined septal extension-columellar strut graft that was first introduced by our team in 2023. Dr. Sherris, can you comment on the motivation and rationale behind the design of this novel graft?
In the past, I commonly used columellar struts placed in a pocket between the mediocranial feet and not attached to the caudal septum. But I did note over time, sometimes these grafts lost support and the tip thus suffered. I've also used a lot of septal extension grafts, and my main concern with some of them is that side-to-side grafts I worry are going to block the valve angle, and end-to-end grafts can occasionally shift one way or the other over time. Finally, the classic septal extension graft can make the tip feel somewhat immobile and stiff. So to try and avoid that, I looked into this combination graft as a new technique to use the best of both worlds while trying to avoid some of the pitfalls of each graft.
Thank you. So how does this combined septal extension-columellar strut graft used in this study differ from a traditional caudal septal extension graft?
The main difference is in the lower 2/3 or so of the graft. The lower, for a septal extension graft, typically the end-to-end graft, the entire graft is sutured to the caudal end. The difference here is that on the lower 2/3, the membranous septum is preserved, and the columellar strut portion of this hockey stick shaped graft sits in that pocket, and it's sutured into place there. The upper 1/2 to 1/3 is then sutured directly to the caudal end of the septum, there being the septal extension portion and the lower columellar strut portion. The lower columellar strut portion allows a little bit more mobility than your standard septal extension, while the superior aspect sutured directly to the caudal end gives added support over time and thereby avoids that risk of tip droop in the longer term.
Okay, that's great. Thank you. So how would you describe the graft, and in what patients or scenarios do you consider using the combined septal extension-columellar strut graft?
The graft itself is somewhat shaped like a hockey stick, and it's placed as an upside down hockey stick so that the blade portion of the stick itself would be at and above the caudal septum, while the thinner shaft type portion of the hockey stick is placed in the pocket as the mediocranial foot portion. I use these type of grafts especially in the under-projected nose, under-rotated nose, or poorly supported nasal tip.
Okay, that makes sense. Thank you. So in our research study published in Facial Plastic Surgery and Aesthetic Medicine, we performed a retrospective chart review of 32 patients who underwent septal rhinoplasty using the combined septal extension-Columellar Strut Graft to address poor nasal tip support and under rotation. We measured functional outcomes in this study regarding their patient's nasal breathing by the Nasal Obstruction and Symptom Evaluation, or NOSE scores. We also looked at aesthetic improvements through analysis by independent reviewers who graded before and after photographs using a modified rhinoplasty assessment scale. In our study, the mean patient age was 32 years old and 97% of the patients were female. All of the surgeries were primary rhinoplasties, 22 of which were cosmetic and 10 were functional. All of the patients had a minimum of 1 year of follow-up to be included in the study, and the longest follow-up time for the patients was 2.5 years. All of the patients showed improvement in their nose scores postoperatively, with mean scores indicating a decrease from moderate severity to mild severity postoperatively. All of the patients demonstrated improved nasal aesthetics based on photoanalysis in basal and lateral views as well. There was significant improvement, particularly in tip projection, tip rotation, and columellar show, as well as the columellar-alar angle. Dr. Sherris, what has been your experience with how the combined septal extension-Columellar Strut Graft has contributed to improved nasal aesthetics in your rhinoplasty patients?
I've found it to be a very versatile and useful graft. Certainly, I will apply other techniques in concert with it, including tip sutures, tip grafts, both cap and shield type grafts, and other techniques. But certainly, this is a great graft for tip support, and I've continued to use it over about the 4 years where I started using it. I have noted good aesthetics and support that's been maintained in patients with longer follow-up than this study has demonstrated.
Thank you. So in conclusion, this retrospective case series highlights the success of the novel combined septal extension columellar strut graft in providing stable nasal tip support, improving projection and rotation postoperatively. Used alongside other rhinoplasty techniques, patients in this cohort experienced cosmetic enhancements in nasal tip appearance from both lateral and basal views that were maintained years postoperatively.
We'd like to thank the authors for their commentary and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.